I think we are. Okay. We'll call a meeting to order. First order of business is to approve the minutes of the last meeting. Anyone have any additions or corrections?
They look good to me. This is Laura Negro. I'll make that motion.
Nope.
I will second it.
Bill, motion by Laura, seconded by Bill to approve the minutes of the last meeting. All in favor signify by saying aye.
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 Opposed? Motion carries. We'll now open up public comments. This is not the same as the public hearing. This is public comments. Anybody from the public wishing to make any comments? Nobody here in the boardroom. Anyone online wishing to make any comments from the public? Otherwise, we'll move on to the Brighter Futures Initiative update. And maybe we won't have that. Is it? Doesn't look like he's there, so we'll move on to the 2020 annual report.
Okay, thank you, everybody. The department heads have worked really hard on their annual reports, and they are compiled on the table. If anybody needs them here, they are available online also. As you all know, it's been a really tough year, so I'm extremely proud of the staff who have persevered and been extremely creative and resilient and worked hard through all of this. And I think you will see in their reports how well that is reflected. So we'll begin with adult unit and ADRC with Laura Compton.
Hi, everybody. All right, so with the adult unit, we are made up of 7 social workers and a half-time case manager that oversee the Aging and Disability Resource Center of the North, our mental health and substance abuse services, emergency mental health program, coordinated services teams, children long-term support, and the community options program, adult protective services, the Schwamigan Coalition on Emerging Drugs, and representative payee services. If you go through the adult unit report, each of those is laid out that talks about different things that we have accomplished during the year. I'm just going to highlight a couple of them for you. One of the big things we noted was a significant decrease in March, April, and May of the year due to COVID. It seemed like our referrals kind of went to a standstill when COVID really first hit. After that, it kind of, people got used to what COVID was, and we saw the opposite happen. Overall, our referrals were down in 2020 as compared to previous years. Specifically talking about our mental health and AODA, I want to talk about that because those are the programs that directly correlate to cost out of the adult unit. That is what directly affects our placements and the high costs that we have. So we had 29 settlement agreements in 2020, which was a decrease from the previous year sorry, I mixed up my numbers. So there were 78 emergency detentions, including 3-party petitions in 2019, and that decreased to 61 in 2020. Of those, 29 were settlement agreements, which means that somebody agrees to outpatient treatment, they remain in our community. 11 went to commitment, and that's where we see a lot of our placements come out of. That means that they are a danger to themselves or others and need to be either in a group home or an adult family home. And at times that's when we have our Winnebago and Trempealeau stays. And that's where our high costs really come out of. We work with those programs to get them back into the community. But that is, we again had a lot of placements that drove costs in the adult unit last year. Otherwise, our children's long-term support program in 2020 had started to increase. So we served 26 children in 2019, whereas we only served 22 in the previous, 26 kids in 2020, 22 kids in 2019. That is the program that works with children that have disabilities that could potentially be placed out of the home in hospital settings. We are able to provide support to them locally and keep them in the home with their families, providing respite and different activities so that they're able to attend school in our community instead of being transferred across the state to different facilities. Adult Protective Services, in 2020, we had 86 investigations, which was a decrease. We had 116 reports that came in 2019. It was very interesting with COVID. We tried to do as much of the investigations via collateral contacts or through Zoom or phone calls instead of going into the home. APS and our mental health worker were the first two in our unit that were fitted with PPE to be able to go into homes when there were emergencies. And so they had been going into homes throughout the entire pandemic, whereas we tried to decrease that in other parts of our unit whenever possible. That is the main highlights that affect the budget. Do you guys have any questions? All right.
Did any of the county workers or get COVID?
Is Bill by a microphone? Because I didn't hear what he said.
He asked if any of our workers had contracted COVID, and not in the adult unit that I'm aware of. We did have some, but that was in public health. And as we know, they were on the forefront of everything. But as far as I know, those were the only employees that we had that contracted it through work.
Thank you.
I would just point out too, this is Terry Barningham, just as Laura said, with APS, they were one of the first in her unit to get outfitted with PPE. And I just wanted to remind everybody, we couldn't find PPE to save our soul in the early stages. So we were very creative with what we used, and we reused PPE once we did have it. So the staff, you know, it was a very nervous, kind of scary time, and the staff did exceptionally well with limited resources. So they did great. Then next we'll go to Kelly and child support.
All right. Hi, everybody. So just to highlight a little bit about child support, we have our child support attorney, Griff Nordling. We have myself, 3 child support specialists, a legal secretary that does child support and adult emergency detentions, a part-time financial specialist, and a full-time administrative assistant working in our office. Just some highlights from 2020. It was definitely a challenging year for everybody. It was no different in the child support offices. We successfully, like everybody else, got all the staff set up to work remotely. We had 2 remain in the office that stayed in the office the entire time. We had 3 staff with children in 3 different schools that managed to maintain the caseload and workload while dealing with school closures and all of that. Our clients in particular lost jobs. They couldn't find jobs. They were laid off and or were sick with COVID multiple times, or caring for someone with COVID, or quit their job because they had to stay home and take care of their kids. So collecting child support was extremely difficult in 2020. We also were not able to issue warrants, so we started thinking a little bit outside of the box, and we had always been partnered up with Northwest SEP and Workforce Resources. However, we made that partnership a little more streamlined, where we did electronic referrals and we got access to their case notes, and so we could find out if people showed up and things like that. And we started getting court orders rather than for warrants, for people to work with the job programs and try to get employment. We were successful with people that actually wanted to get a job. People that didn't, it was not as successful. Also in 2020, our staff took advantage of all of our child support trainings becoming virtual. And we successfully completed 10 different trainings that we just did not have time to do or the money to travel to do them before. And while we all know that virtual training can't replace the connections that we make when we're in person, it was great for all of us to get this training in. The charts are our performance, or our funding is based on our performance. And there are some charts in there that show, so in order to get 100% of the funding for each category, you have to be above 80%. And we are above 80% in court order establishment rate, which means that we establish all of our court orders timely. And paternity establishment rate, we are up there and always up there, which means we establish paternity for all the children in Ashland County that are born to unwed mothers. Arrears collection rate, we have gone up, but we struggle with that, and we struggle with current support collections. And current support collections is collecting the full amount of child support due every month. So if they owe $250 a month and only pay $248, we don't get that collection. So we are working really hard at those right now, but living in Ashland County does not make it easy. We continue to struggle with low paying jobs, families living below the poverty level, drug addiction, children placed out of their homes, things like that, continue to make that a struggle for us. Just when we think we have somebody moving in the right direction, something changes that. So we are committed to making that better in 2021. And that's all I have. Does anyone have any questions?
Good report.
Thanks, Dr. Keller.
Bill?
What was the highest that you ever went as far as collection? Now it looks like 74%. Where you were before, did you ever get to a point where you were at 90% or 80% or?
In arrears collection and current support collections, we have never gotten above 80 in all the time I've been here.
How many years is that there?
5, 6.
Okay.
And before that, it wasn't measured. Your funding was not based on performance. So it didn't matter. So I don't know that it was really tracked as much as
It is now.
it is now. That's correct. Anybody else?
Kelly, on that, not getting up to that 80%, what are the things that stand in the way? Is it that jobs or your thoughts?
Definitely. I wouldn't say jobs right now because people can get them. They just aren't. I would say drugs and kids out of home to drug addicted parents, or because of abuse and neglect when someone is placed in foster care or kinship care when a child is. We get orders for both parents to pay, so mom and dad. And if they're not stable enough to have their kids in the home, typically they're not stable enough to get jobs. So that has been hard. We've seen people go to rehab and they come right back out and they get a job and pay, and all of a sudden they go right back to, there's no place for them to go. So they go right back to the friends and family they had when they were using, and we don't see them again for a year.
Do you know if there's ways to work with wellness court in order to help
No.
these people get a stable base, or, I mean, I know we're reaching for, just family stabilization mostly with addicted populations, but would
Yeah.
that be an avenue to work with them?
We do work with them already. We talk to them, or I talk to them on a weekly basis. We attend drug court or wellness court when it was going, if there was someone we were unable to find or locate, and Allison or Ann would say, well, I know they're gonna be in court today, or they're getting a test today. We'd track them down in the courthouse and talk to them. We get their lists of who's in wellness court and compare it to who has child support orders. So we do work with them now. We are working also with the state to right size orders. Some of the orders are just too high. They haven't been reviewed, and somebody's making $8 an hour and working 40 hours a week. They can't pay $500 a month in child support because they will not pay their rent. So then they'll end up homeless. So we are working, and there's a huge push right now to get those orders and get them reviewed and get them right sized to what people can actually afford, so that we can get hits on those things and boost our performance.
Excellent. Thank you very much.
You're welcome. All right, well, thank you.
Thanks, Kelly. Next is the Children's Unit with Jerry Esela.
Good afternoon, everyone. I guess the first thing I need to do is give credit where credit is due. Prior to Jenny leaving the beginning of March, she did complete our annual report, which was very kind of her. I don't think she had to do that. So the information I'm going to be going off of today, she had provided. Also, with that being said, I want to thank Jenny for her service to the people of Ashland County, especially through the very difficult year of 2020 and COVID. In the children's unit, there are 7 workers. While these workers have specific job duties that they are assigned, all of the workers are co-trained to be able to do other jobs. All of the workers are trained in juvenile court intake. They are all trained in access, trained in initial assessments, and CPS ongoing. One of the things that was very scary in early 2020 when COVID first hit was we predicted at that point in time that we would have a large influx of child abuse and neglect cases once the school shut down, just because the children were not going to be out of the school or out of the home for any length of time. Just having access to maltreaters would increase the numbers that we were going to see greatly. Unfortunately, I think that abuse and neglect continued to occur. However, we in the months of March, April, and May saw a sharp decrease in the amount of reports that were made to the agency, and we attributed that to the children not being in the school or other areas in the community where people would interact with them and end up making a report. We also saw a somewhat of a decrease in the amount of juvenile court referrals that we had during the course of 2020. Again, that was mostly early on in 2020, and as the year went on, we did see more of a bump in juvenile court referrals, and it appeared that a lot of the incidents that were occurring were of more severe nature, more property damage, and so forth. Some of the specific accomplishments that the unit had over the course of 2020, 2 of which I think are very important, are we did 4 termination of parental rights cases that were completed in 2020. And you'll see that in your report, but I can add a little caveat to that all 4 of those children, as of yesterday, were adopted and have their permanent homes. We had 2 additional TPR cases that were actually filed in 2020, and both of them have now been completed. the big benefit to us in that is that all of those children are now in permanent situations, which ends their out-of-home placement, saving money for the county, which basically accumulates on a month-by-month basis that those children are not in out-of-home care. One of the other really big additions to our unit in 2020 was the hiring of a family specialist. The family specialist position is almost entirely grant funded. Our family specialist goes out into the community, working with our families in both the CPS and youth justice systems to increase their skills and abilities in parenting and basically addressing any other kind of safety concerns that are in the home, allowing those children to continue in the home and not result in out-of-home placement. And that's all I have. If anybody has any questions. Thank you.
Okay, next we have the community support programs or community service programs with Val Levno.
Good afternoon. So 2020 was a very interesting year for all of us. And it was no different in our psychosocial rehab programs that provide services in the home and community. Early on in COVID, the state made it very clear that we still had to provide services to the folks we serve. And I detail in the report all the things we did and some of the things the state did to help us continue with those services. Our CSP program continues to be a small program. We did increase the number of people we served in 2020 over 2019. You'll notice in the diagnoses section, the CSP serves, the majority of the folks in the CSP have thought disorders like schizophrenia, schizoaffective disorder, where the majority of the people in the CCS program have mood disorders. In CCS, the number of people we served in 2020 decreased about 15%. And a lot of that was due to COVID, right? Well, throughout COVID, there were folks who just didn't want to have any contact with anybody. And so a lot of those folks decided to be discharged, and then anybody who was close to having some kind of improvement and it looked like they had the skills to be able to move forward without services, they were hooked up with other community services and discharged. One of the things that happened last fall was one of our major vendors gave us notice. And so a lot of that home and community support that folks needed, that we were providing through those contracted services, we no longer had capacity for that through contracted providers. All of our county staff rose to the occasion and began triaging the folks they were working with to figure out which supports absolutely needed to be provided, and then they began to provide those supports themselves. We continue to do that. Though we have identified some vendors now, and hopefully by the next board meeting, I'll be able to come to you with some really good news about contracted vendors. Just to give you an example, well, we lost 72% of our contracted vendors in skill building. We also lost 28% of our therapists. And wasn't specific to the program, but was more specific to therapists not working at our local BHU, North Lakes, Northland Counseling, those kinds of things. As far as other significant changes of the people we serve as far as diagnosis, there was a significant increase in people with personality disorders, which we had 83% more people in 2020 with personality disorders in 2019. That's a fairly large increase. The other main increase is meth users. Significant increase in 2020 of folks with meth. But of interest is that the number of people using opiates in 2020, there was a reduction. So that's kind of the highlights. Any questions?
What was the percentage of loss of therapists that you said?
28%.
Thank you.
This is Matt McKenzie. I guess I've got a question in talking about meth and opiates. It's recently been in the news that we're having more overdoses than ever, but your numbers don't seem to indicate that. How do you view that?
Well, that was 2020. This is 2021. And so I haven't seen all my statistics yet for 2021 because we're still in the data collection for that 2021. But I do anticipate that we'll have a dramatic increase. And I've been in the psychosocial rehab world for 25 years now. And it goes back and forth. Sometimes they're both. And a lot of times folks are using both. But just because that was the experience within the program also doesn't mean that's the experience within the county. You have to remember this is a voluntary program. So the folks who are in our program are the folks who are seeking treatment.
Okay. I guess if you have any ideas on what we can do towards that direction, I'm sure you would have told us by now, but it seems to me that it's something that needs to be on our radar as a committee to deal with those issues.
Yeah, I agree. And I think Laura would be the one who could address that as far as countywide issues versus program specific issues.
May I just comment that I think some of that skewing to opioid deaths is probably more related to the increasing availability and presence of fentanyl, which is, not been present in the same quantities or strength as in the past.
That is what I've been told. And I think that's what's being reported. Again, I would defer to Laura Compton as she's our substance use and mental health expert in the community. What about the increase in opiates recently and how are we addressing that?
The increase in the overdoses recently is due specifically to a bad batch of heroin and methamphetamine that have been brought into the county. They are highly, almost all fentanyl, according to the coroner. So about a couple weeks ago when I talked to her, she basically said things will get probably worse before they get better, but it's directly related to a bad batch that was brought into our community. As an aside, there's a very robust Narcan program that Bad River puts on. It's available to family members, friends, the users themselves, so that they have that to dose in case there is an overdose. But by what I've been told, the Narcan is not able to reverse the effects because the fentanyl is so strong. And so people try to dose their family members or friends several times till they run out of Narcan, and then they call for help, and it takes a long time for EMS to get there. Oftentimes it's too late to revive the person.
This is Clark. We have also been working with DHS and through the tribe for Narcan distribution. So there's a Narcan Direct program that Terry had mentioned. And we basically are looking at backfilling some of the Narcan supplies at the fire department here in town, because as more and more people use Narcan and it becomes, the price is going up and the supply is going down, the state is able to backfill, and we did hook up basically to get the fire department and the sheriff department if they need it. So we're thankful to Bad River for helping us with that program.
Are there any other questions? Okay, thank you, Val. Next is Economic Support Unit with Melanie Connors.
Good evening, everyone. So I'm Melanie Connors. I'm the Economic Support Supervisor here for Health and Human Services. And I gotta say that I'm quite proud of my staff this past year of 2020. We actually have 6.5 workers that we relocated working remotely. As of the passing of the resolution to allow that remote work continue, they'll continue to work from home permanently. And so with that remote work, the consortium actually purchased our equipment. They have laptops, they have 2 monitors, a keyboard, a mouse, and they have a port, what it's called, so everything connects to that port and then to their laptop. They will be getting their stand-up desk soon. And so they have everything that they need to work from home and have done so successfully. And I gotta say, our workers had a full manual of temporary policies in the past year. If you know economic support, our manuals are no less. Last time I printed one off before 2006, those manuals run from 3 to 4 inches on a 3-inch binder. So we have a whole manual. Yeah, we have a whole manual just for temporary policies that changes we've instilled in the past year for COVID temporary policies. And our customers actually benefited from a lot of those temporary policies. For Ashland County specifically, we had over 220 additional healthcare cases per month on average. And then also in addition, they received over $1 million in additional food share benefits in the past 2020. So again, we have 6 workers working remotely. We had 2 in the agency, and our child care certifier also was working remotely. We had a lot of temporary policies for this child care certification program also. She did a lot of phone reviews and spoke to people as best she could via Zoom. And so again, I feel very proud of their accomplishments this past year. Any questions? Go ahead, Bill.
Have your hours changed at all?
Our hours have not changed. Our call center hours always remained 8 to 4. Any other questions? Well, thank you.
Okay, and next we have our fiscal unit with Pete Hurley.
Hi there. The fiscal unit, most of what we do, of course, is behind the scenes, necessary, paying bills, doing billing for our services, lots of reporting at the state and federal level. As always, I talk about this every year. We are always trying to improve the efficiency of these things that just have to be done, trying to automate and so forth. we impact, we do have, a lot of what we do doesn't have a direct impact on the finances. Some of what we do does, for example, providing relevant financial data and analysis for different situations, so we can make purchase decisions, hiring decisions, what have you. So we're always looking to make sure we do that properly. We also try to save hard dollars where we can, and we try to generate revenue where we can. In 2020, that was our first full year where our unit was down 1 FTE. We did that intentionally. That went well. It will continue to save money going into the future. The other thing that we did at the end of 2020 was, and that wasn't effective till 2021, but we took on the fiscal agent duties for the regional ADRC of the North here, the Aging and Disability Resource Center. So what that will mean is for that 5-county consortium, we essentially do all of the financial work. We do the billing for all 5 counties. We receive the funds. We distribute those funds back to the counties appropriately. We do reporting. What that will do, and it's a good opportunity for a unit like ours because very rarely is work that we do directly billable to programs. But once that transition is complete, Bayfield County had done it for years. Excuse me. Once that's complete, that will generate $30,000 in revenue a year. This year, I believe we're going to collect in the neighborhood of 16. So that's a good thing. So like I said, we're kind of, we are not heard from too often, which is good. I do usually have a lot to say at our monthly partnership meetings with all of the employees. Today was unusual in that I did not have much to say. Yeah, we do our work. We're doing it as efficiently as we can, and we're trying to save hard dollars and generate revenue where we can.
Any questions for Pete?
No question, just a kudos. Oops, go ahead, Bill.
Go ahead, Laura.
Just a kudos. Thank you, Pete, in your department for being as proactive as you are. And I say that knowing that all of the departments underneath HHS have been very proactive with trying to find these same kind of swaps and ways to make revenue and cut expenses. You guys have been great when it has come to the thoughtful way that you have spent the money of the people in order to give them the services at the maximum amount. I am proud to be on this committee.
Thank you.
Bill?
How is our budget doing overall? We're about halfway through.
For this year?
For this
We'll
year?
talk about this in a little bit.
Okay.
Agenda number 11.
Okay.
We'll go through that in however much depth as you want to.
Any other questions for Pete? Next, we'll have public health. Liz?
Hello, can everybody hear me okay?
Yep.
All right, so just kind of summarize and go over some of the programs that we have for public health. So to begin with, for public health, we have 1 birth to 3 coordinator. For staff, we have 2 environmental health specialists. 1 also serves as our public health emergency preparedness specialist. There are 3 nurses other than myself. And throughout the course of 2020, we actually had up to 7 limited term employees, mostly for the purposes of contact tracing. And then we also had crossover training for some other departments to assist with contact tracing as needed. My apologies. She's totally silent until I start talking. Uh, For our community health improvement plan, which is required per Wisconsin State Statute 251.05. Since 2011, Ashland and Bayfield counties and Memorial Medical Center have collaborated in this process. Beginning in 2018, the community health needs assessment and the CHIP process also included Iron County in the partnership. The steering committee implemented the plan to address AODA and mental health concerns in the region and focused on primary prevention targeting youth. The community health needs assessment and CHIP partnership began preliminary planning for our next cycle, so 2021 through 2024 in the fall of 2020. Due to the COVID-19 pandemic, the initial planning meetings were held over virtual platforms. We are currently working with our partners on the community health needs assessment, which is anticipated to be released soon. This year, we do have 2 interns to assist with this process through the AHEC program. 1 intern for Ashland County and 1 intern for Bayfield County. Another program to highlight is our public health emergency preparedness, which is usually a behind the scenes program that we have. However, throughout 2020, FEP was very front and center through the COVID-19 pandemic response. Numerous of our emergency plans have been revised and continue to go under revision to ensure a community approach to meet the needs of all individuals. We maintain an active role in our regional HERC, which is our Wisconsin Healthcare Emergency Readiness Coalition. And we help to participate with our hazardous vulnerability assessment, as well as contribute to after action reports associated with COVID-19 efforts and mass vaccinations. One of the main areas that occupied public health throughout 2020 was disease control and prevention. Beginning early in 2020 and throughout the remainder of the year, a large emphasis and focus has been on the pandemic. Local and tribal health departments have been focusing on a broad range of testing and epidemiologic surveillance activities. Nearing the end of 2020, additional activities and efforts were made to support the COVID-19 vaccination for community members. As you can see by the graph that's included in our annual report, the total number of disease investigations substantially increased during 2020, directly attributed to COVID-19. Of the total number of investigations, 9,450 of those were related to COVID-19. The remaining 213 disease investigations were conducted simultaneously as COVID-19 was ongoing. Predominant communicable disease investigations other than COVID include chlamydia, hepatitis C, influenza-associated hospitalizations, Lyme's disease, and pertussis. A couple other areas just to note for our maternal child health program. Over the past several years, we've seen a decline in the number of moms referred to both prenatal care coordination and maternal child health programs. Beginning in 2017, there were a total of 88 referrals. In 2018, that decreased to 78. 2019, there were 61. And then in 2020, there were 59. We continue to conduct community outreach and education to our different partners regarding the availability of sources and resources to new moms and infants. During 2020, this included notification that the program was still there, it was still ongoing, and the modifications that we made to try and continue with our services. This also pertained to the Women, Infants, and Children program, so the WIC program. They did have several modifications. Their outreach clinic was actually only completed in the first quarter due to COVID-19 restrictions. The remainder of the visits were conducted via phone or Zoom. There were a total of 653 participants in the program in 2020, which was a decline noted from the 713 of 2019. WIC has seen a decreasing number of participants over the past several years. So COVID just contributed to that this past year. Immunizations, we continue to provide all of the vaccines offered in the state's vaccine for children and also many of the vaccines offered for the vaccine for adult program. During 2020, there were 107 vaccinations provided through the public health clinic. This is a notable decrease in the number of vaccines provided compared to previous years. We also do provide the seasonal influenza vaccine. Our vaccination clinics looked much different this past year due to COVID. Primarily, we offered flu vaccines through drive-through clinics as compared in the past. We also had continued a pilot program that had initially been started in 2018, where we provided immunizations in the jail setting. We were able to do this for several months, focusing on hepatitis A prior to access being limited due to COVID. We followed up in the fall with an additional vaccination clinic being offered for the influenza vaccine for those that were interested. We also continue with our family planning and reproductive health program. We do operate a full service women's health and family planning reproductive health program. The program is confidential and free to anyone of childbearing age and is offered to all persons seeking services, including our maternal child health and prenatal care coordination clients, and those that are identified as contacts for sexually transmitted infections. HCET, Healthcare Education and Training, is a partner for one of our programs. They offer a lot of assistance, training, guidance, and provides funding to support our work. Through them, we offer the Get Yourself Tested program, where we've partnered with Northland College to offer clinics on site for STI testing and treatment. Some of our clinics were canceled due to COVID, but they were able to successfully complete 5 clinics throughout that. And another highlight is our agent licensing program. So that would be our inspections of various different food, retail facilities, lodging facilities, pre-inspections for new businesses. There was a decrease in some of these inspections in a few areas during 2020. Some of the main reasons for the decrease was many of the seasonal businesses delayed their openings, or in some instances, they opted to remain closed for the season due to that, due to COVID-19. Our child lead testing program, we did see decreased numbers there, in part due to COVID. Some parents actually opted to skip some of their well child visits just out of fear or concerns from being in healthcare facilities related to COVID-19. And also with WIC being not in person, it decreased the number of some of the childhood lead levels being tested. There has been follow-up outreach done to provide education regarding the importance of well child visits and routine testing and things like that. We also had partnered with the state of Wisconsin for the Lead Safe Healthy Homes program. And the intent of that program is to build capacity for lead safe renovations within Ashland County and the immediate surrounding area. We had partnered with Lake States Environmental to provide this training and education, and we were able to initiate training of lead safe renovator refresher program for 3 local contractors, and then started the initial lead safe renovator course with 12 additional contractors prior to the training coming to a halt because of the pandemic. We are currently working to resume these training activities, and we have actually been advertising just recently for contractors to try and resume this training program, as well as looking for homes that would qualify for the potential for renovations for people that may be identified as at risk for lead poisoning. Our walk-in clinic did remain open throughout the pandemic. Obviously, we saw a significant decrease in the number of people that attended our clinic. We had, let's see, there were 409 separate occasions where people utilized the clinic, which was a noted decline from the 685 from the year prior. Also, our blood pressure clinics that we had previously provided on site at the senior meal sites, those were postponed due to the senior meal sites being closed for in-person dining. Right now, tentatively, the senior meal sites are scheduled or planned to resume beginning July 1st. So we will resume our blood pressure clinics on site for those as the senior meal sites reopen. And that kind of covers a lot of the highlights. Does anyone have any questions?
That's a bunch.
Bill again.
Was there many young children that contracted COVID? Or was it mostly older people in the county or in Bayfield County and Ashland County? Was there any children or minors?
We have seen COVID positive individuals. I believe the youngest have been 3 months of age, 2 to 3 months of age. I'd say overall, the majority of the COVID positive cases were adults. Initially, when COVID started, the majority of the cases were in older people. I'd say kind of a generalized age 60 and older. As the pandemic has gone on, we've seen the average age of positive individuals become younger and younger as time has gone on. As of recently, I would say that has been the most common occurrence over the last couple of months, where we've seen adolescents or children, as I had said, as young as, I believe the youngest was about 2 months of age, testing positive. Generally in those cases, it's the child is a household contact, a family member. So the entire family has tested positive in those instances where we've seen the very young children be positive.
Any other questions for Liz? Okay, we'll move on. I think that,
This is Matt McKenzie, not really a question, but just a comment. I want to thank you, Liz. I mean, can you hear me?
yeah, you're kind of breaking up a little bit.
Can you hear me, Clarence?
Yep,
I guess not.
I can hear you. Can you hear me?
How about now? I can hear you. I just wanted to make a comment in all through this. I want to thank Liz for her work in that I received nothing but really compliments from the public as far as how the program went. So thank you.
Thank you for that, but I do have to give credit where credit is due, and a lot of that credit goes to the rest of the public health team. We've had our moments, but we've kept each other sane.
Any other questions or comments? I think that completes our 2020 annual report. And I think Scott is on the line now, so we'll go back to number 4 on the agenda, Brighter Futures Initiative update.
Hello, everyone. Apologize. I had apparently the wrong link for a while. I was waiting for the meeting to start, which apparently started about 20 minutes before I got on. So we've been doing really well with the Spark program. Obviously last year things shifted, and there are some things from the BFI Spark program included in the annual report as well. So you can kind of check and see within that annual report some of the numbers from last year. We did see a pretty significant increase in the number of what we call number of one youth attending for one day of programming. So we had about almost 2,300 kid days in 2020, even with COVID-19. That was a about a 40% increase from 2019. And here in 2021, we're approaching 2,000 kid days as of today. So we're on target to nearly double our attendance numbers from 2020 here in 2021. So that has also been with us needing to kind of keep our daily attendance numbers limited. We built a reservation system online. So all of our kids are, for the drop-in program, have been making reservations each day in order to participate. And we limited those numbers to about 30 kids per day in our new space. And that has worked well. Luckily, at least as far as we are aware, we have not had any positive COVID tests amongst any of our students or staff. So I feel like we did a good job of running the program effectively while keeping everybody safe, following the CDC guidelines and the guidelines that we worked out with Liz and the rest of the public health department. So I feel really blessed that we were able to provide a really good service to our kids, basically 5 days a week, starting last November and all the way through now. And we are shifting now from our drop-in program that we do during the after school period during the school year. And we are now shifting into our summer model, which is working with our kids in a more of a small pod format again this year. This year, the pods will be focused on specific themes, as opposed to last year where our pods really were primarily all about keeping kids isolated into small groups. We feel like that's a little bit less necessary this year as these kids have been hanging out together in school and at Spark for the last 7 or 8 months. So we're diving into our summer model. We're serving approximately in 2021. I just ran a quick report on our attendance numbers up to date, and we have about 120 active kids right now. Some of our most active kids have been to Spark over 75 days this year already. And so that's pretty, it's good to see that the kids that are really active are coming on a very regular basis. And I think we're having a really great impact with those kids. Aside from that, we're looking into the next 3 years. The grant, as most of you are aware, does officially technically end at the end of this calendar year. But we do anticipate that the RFP for the BFI grant will be announced here shortly, sometime over the next month, and that we will certainly be reapplying for the grant for an additional 3 years. And while I cannot say that I'm confident that we will receive that grant funding, I am optimistic. We are getting good indication from the state that they're excited about what we're doing. They think that what we're doing is pretty innovative. So I'm optimistic that we will be able to secure that funding for an additional 3 years. And at that point, we'll be able to take another little bit more of a long look at what we're doing through the program. As a little bit of a, kind of reflecting on what I heard in some of the other reports. One of the things that myself and my staff are excited about expanding, obviously, is down into the southern part of the county, which really got hindered by COVID. But we are really excited also about starting to expand the reach into our families. We are technically by the grant a substance use prevention program, but I know that all of you are aware that what we can do with our kids only goes as far as what we can do with their families. And so we really want to start doing some more outreach and helping families connect the dots to additional services that are available through the Health and Human Services Department, through the CSP program, and through some of our other community partners, because none of our kids are okay if their families aren't okay. And that is a next big step for us, is to start to really help those families connect the dots as well. So that would be something that we'd be looking at in our next triennium if we are able to secure that funding for an additional 3 years. Any questions?
Guess who? Bill's got one.
Are the kids and the staff, are they, anybody wearing masks yet, or are they pretty much no longer doing that, or?
Everybody wears masks indoors. With the staff, we are following CDC guidelines, and we are allowing staff who are vaccinated to go maskless when it is just staff members in our space. But when we are running programming, anytime we're indoors, we are asking all staff and kids to wear masks, because most of our population is still not vaccinated. We do have, we are really advocating that our kids talk to their parents about getting vaccinated. We certainly are looking forward to the day when we don't have to wear masks indoors. We have adopted a policy where we don't require our kids to wear masks or our staff to wear masks when we're outside.
This is Supervisor Ortman, if I might, Clarence.
Go ahead, Charlie. I was thinking you were here with, your name had changed to Bill with all the questions.
Well, that's a good thing, right? First off, Scott, I'm just, I couldn't be more grateful. I personally know kids that are going there to Spark now, and I feel that Spark is a buzz, is a buzz among the group, among children, and children of all economic stripes and various struggles with growing up and whatnot. It's just, it's a place that has no no negativity about any child attending that I've noticed, and I think that's great. Obviously your numbers explosion speaks to the popularity and effectiveness of this program, and I imagine will be an excellent selling point in your gaining the next grant funding. Are those grantors looking at your program to maybe copy it and transport it, and then maybe at some point this will be regularly funded, and the grant part will go away and it will just be realized for the value it is, and then it will be funded at like more traditional programs? What's your feelings on that?
Charlie, I think it's really tough to say. Grant funding is a fickle beast, unfortunately. I will say that one of the reasons that I would decrease my projection from confident to optimistic is that the BFI grant has really requested in the past that everyone is using evidence-based programming, evidence-based practices, and evidence-based practices are a very specific set of practices that have been proven through double-blind studies and a number of other things to be registered on the National Registry of Programs, this database called the NREP. We are using the BOT-BIN Life Skills curriculum, but not directly at the Spark program. So we are offering the BOT-BIN Life Skills curriculum with a partnership through the Ashland Middle School and the Public Health Department. That did get, so the BOT-BIN Life Skills curriculum is the evidence-based practice. What we are using at the Spark program is more a conglomeration of things that we've seen around the world that are helping kids build resilience but it's more what we would call evidence informed. And so we were pretty transparent with the state about we've been very transparent with them about what we're doing. One thing that I will say is that when we go to reapply and we tell them what we are planning to do, that we don't have what is known as a true evidence-based practice in the Spark program. It's an evidence-informed practice. And so we are gathering some of our own evidence, but I will say that it is unfortunately very difficult to prove that you're preventing things. And so when we're looking at a substance use prevention program, it's difficult to prove prevention. And so I think that there is great anecdotal evidence that we are having a strong and solid impact, positive impact on our kids. I believe that to be true to the bottom of my heart. And but that's one of the pieces that I think will be part of the discussion as we move forward with the state.
So what are your feelings then as far as this program becoming, I guess, somewhat outlined? And do you ever see this as being transportable? I know this is kind of a version of the Iceland program. It's our
Right.
how we could get it going in some small way. But to me, the evidence is clear with the numbers of children. I mean, success is a hell of an indicator. So are you feeling that? Well, you mentioned, I'm going down this track because you mentioned earlier that the grantors were I guess impressed with your innovation. Is that what they called it? It was innovative and out of the box type of thing. And why were they making those comments if they weren't happy with what they saw, I guess?
It's not that they're not happy with what they're seeing. I think that part of the reason that it's innovative is because what we're doing isn't an out-of-the-box evidence-based practice. So a lot of folks who are using BFI grant funding, they are using an out-of-the-box evidence-based curriculum, and we are building a program from scratch and meeting our kids where they're at, responding to the needs of our kids on a pretty day-by-day basis, to be perfectly honest. And we're pulling in a lot of the most, kind of the most recent and updated information, based a lot on things that I learned through my years with the school district in the Aware Grant program that we were involved with for 5 years before the BFI grant came on board here for the county. So I think part of what is allowing us to be innovative is that we're not trying to use it out of the box, prepackaged evidence-based curriculum. But that can be seen as a positive, depending on the folks that are reviewing the grant. It might be seen as a checkbox in the wrong direction because it's not quote unquote evidence-based.
Okay, but the bottom line for this grant is successful strategies to prevent drug abuse or bad choices by children.
That's the goal. The difficulty is proving that that what we're doing is having an impact on reducing substance use. And the only way that we're able to gather that data at this point is by asking kids to self-report, anonymous self-reporting, and we are doing that. But it's not a perfect data gathering method.
Is that the only metric you think you can find that would be useful?
I've had some conversations with Jerry Essela regarding taking a look at some statistics with regards to youth justice referrals. We are in conversation with the school district trying to put together an information sharing MOU with the school district that could compare kids that we consider active kids with Spark, and to see if what their disciplinary referrals looked like, their attendance data, et cetera, looked like, what their attendance data and their disciplinary referrals looked like before they started attending Spark and what it looks like after they've attended Spark. That's a little bit difficult to do because of what's known as FERPA. It's the information. It's basically the school version of HIPAA. So we're working on some MOUs with that. So we're hoping to be able to gather some data from the school district. Liz just suggested that we could take a look at the youth risk behavior survey data from the school districts. And I think that is an interesting model to look at. I think the challenge is with the youth risk behavior survey data is that we are going to have a difficult time proving any correlation or causation of what we're doing and the sample size of the kids that are within our program, kids that are active in the Spark program. They're going to be lost in that larger aggregate youth risk behavior survey data, because that's youth risk behavior survey data is being done with all the schools in the being done with all the kids in the school, and so we can't say that we're impacting all the kids in the school because not all the kids in the school are coming to Spark. So that's going to be a difficult thing to prove any to look at any shift in that data because it's such a large sample size.
Is it parsable? Can you parse it
it's
out?
not parsable because it's all anonymous. It's all anonymized. So we are using some of the youth risk behavior survey questions in our questioning that in the survey and the evaluation tool that we use with our kids. So we've kind of combined some youth risk behavior survey questions as well as some other, and I'm not remembering off the top of my head, kind of how we compiled the evaluation tool that we're using, but it is something that we compiled on our own. And if we look into the next 3 years, I really will be seeking some technical assistance from the university to look at evaluation methods that will hopefully help us gather a stronger evidence base on our own.
Okay, when Extension would send us out to Washington DC, I wish I could remember this. There's a program. I think it's the umbrella of the major federal group that 4-H falls under. They also offer they have huge grants available for people who are doing innovative things like you are, to in order to standardize them and see if they're make them available under this is a kind of education that would help the whole country, or that type of thing.
Mm-hmm.
I'm gonna talk to Extension and see, refresh my memory on that 2-year-old synapse, and see if I can come up with some connections for you out east, and because they're looking at this kind of thing all the time. I mean, their interest is in youth, and obviously the studies that have been done by the Federal Reserve connecting graduation with just simply graduation from high school with going to jail or having a successful life. And it's your kind of programs that see people on to the graduation and successful life program. And there's huge interest in that at the federal level. So hopefully I can find some way to maybe get you some more access to potential cash. But anyway, thanks so much. And it's clear to me you're thinking in all the directions that I would want to make sure you were. And I'm grateful for that. And anything I can do at all, ever, call me. I'll stand on desks for this program anywhere I can go. Thank you.
Appreciate that, Charlie. Thank you for your support.
Any other questions for Scott?
Thanks, everyone.
Thanks, Scott. Now we'll move on to the next agenda item, and that's the public hearing. I'll need a motion to go into public hearing for the purpose of hearing input as we develop the 2022 budget.
I will so move, Clarence.
Moved by Bill. Is there a second?
I'll second.
Second by Charlie. I think this is a roll call vote, is it not? So we'll need a roll call vote.
Clarence Campbell,
Yes.
Dr. Horning, Pepe Cabasa, Dr. Keller,
Here.
Laura Cruz, Matt McKenzie,
Yes.
Bill Metzinger,
Yes.
Laura Negro,
Yes.
Charlie Ortman.
Yes.
Okay, we're now in public hearing. Is there anyone who wishes to make comments in the public hearing section? There's no one here in the boardroom. Is there anyone online? Chat and see what.
This is Mackenzie. I'd move that we go out of public hearing and reconvene if anybody should call in and request a chance to speak to us about this.
I think we recess the public hearing and then we can reconvene if someone appears to make comments. We'll,
I'll second Matt's motion.
okay, motion has been made and seconded that we recess the public hearing. I don't know if we have to, is that a roll call too? We'll roll call vote that.
Clarence Campbell,
Yes.
Dr. Horning,
Yes.
Pepe Kabasa, Dr. Keller,
Yes.
Laura Cruz, Matt McKenzie,
Yes.
Bill Metzinger,
Yes.
Laura Negro,
Yes,
Charlie Ortman.
Yes.
Okay, we're back in regular session and we'll move on to COVID-19 public health update.
Hello, Liz here again. Just a quick update. So for Ashland County, our current vaccination rate is 54.4%. Public Health to date has administered 98 doses of Johnson & Johnson vaccine, 3,165 doses of Pfizer vaccine. So that's a total of 3,263 doses.
The puppies are dark.
We do have more vaccine clinics planned. We're finishing up the school vaccinations this coming week for the 12 to 18-year-olds. Positivity rate at this point in time. So the state rate for positivity over the past week has averaged 1.2%. For Ashland County specifically, 2 weeks ago, our positivity rate was at 0.4%. And the current updated numbers as of today, our positivity rate for the past week has been 0. Any questions?
Hey, Liz, Matt Horning. Any update from Sarah in your discussions? I'd sent you that email last week.
Yep, I did send a draft to Sarah in Bayfield County, and I'm just waiting to hear any additional feedback from her. So I was hoping we would have had the revision to our mask advisory posted, but we're just waiting, just kind of waiting for a final approval to make sure we're good as far as wordsmithing of the document.
Perfect. Yeah, I just, I know the CDC has kind of said we can ease up, and I think everybody that's the sort of law-abiding, rule-following citizen is wishing they could not wear their mask in certain places, but isn't quite sure. And so, yeah, whenever that comes, I think, yeah, everyone still sees the last update and is kind of, yeah, hoping that that will be, yeah, updated soon.
Any other questions for Liz? And we'll move on. Next item on the agenda is the EMS update and removing topic from our standing agenda item. Clark?
What do you want to hear about?
EMS update.
EMS update. So I gave an update at the county board yesterday. For those of you who attended, it is on our YouTube channel also. In short, basically the two towns that have Gordon and Shannon Golden that as of January 1st had not had service. They are going to get service starting on July 20th is the target date. Glidden, who used to have a service before Great Divide came over and kind of broke things up 6 years ago. They're getting their service back together with training and testing for EMRs and EMTs. They have a 23-year-old ambulance. They're hopefully being certified by the end of this year for transport. Right now, the area of Glidden is served by Park Falls Marshfield Clinic, along with the two towns, which are Jacobs and what's the other one? No. Agenda. Yeah. So those two towns have a contract with Park Falls already. What will be happening during the course of the next 6 months is as this service gets more experienced people and more staff, they will slowly transition out of the Park Falls and more rely on themselves to do this. The hope is by January 1st, that they will basically not sign a contract with Park Falls. That being said, there are some hurdles. They probably need to update their ambulance, so they might be looking for money or a grant from the county to help with that. In addition, their business model stipulates that they're going to be using paid individuals during the day. And part of this is just like the discussion we had yesterday, what better way to support these southern towns than to actually have jobs in the towns? They are going to have jobs, a couple positions in these in town during the day, on call hours and volunteers in the evening hours. So that's their business model, and they've put together a budget, and that we got that news on a Monday. So we're very excited to help and see how that progress goes. In the long term, we are still going to be looking at what are the possibilities of providing a larger multi-town 6 to 8 township district in order to spread those costs off. And then the last comment is, because the price of the EMS services from Marshall Clinic for that area was made up of 11 towns, and now as of January 1st, 2022, they'll be going down to 9 towns. The cost doesn't change. It's all fixed costs, obviously. So the cost will slightly go up for the other 9 towns now that 2 towns have the intention of dropping out of the service. That's my update.
I have a question for you, Clark. This $3 million that the county is going to receive for COVID relief funding, is there any way possible that they could get some of that?
So under the current guidelines, there's very limited. There's 5 separate areas that are limited for costs. In my interpretation, a rig is not part of that. In the same aspect, you can't do roads. It's very, very limited to public health and COVID response. That being said, in the next month, we're going to be doing a calculation for lost revenue, and it's a little complicated, but when you get done with this calculation, it will free up money. And then that money can be used for almost anything in the county, with the exception of increasing fund reserves, general fund, which we're struggling with. We don't have enough money, but you can't use it for that, and you can't use it for paying pensions. So after, I'm going to probably get the county back together, county board together in July or August to go through some higher level strategic plans on this $3 million. Yesterday's county board meeting, the county board gave me authorization to make single purchases up to $5,000. Staff does have a list of items: air purification systems, fingerprinting, camera, an extra monitor, soap dispensers, all these little small things. I'll be going through and working with staff to approve those. But in the long term, I think the county board, once we figure out what our lost revenue calculations are and what we can free it up, do they want to address roads? Do they want to address broadband? Do they want to address AODA housing or some sort of a treatment facility? Do they want to address EMS? There's obviously a lot more needs in this county than $3 million. The county board is going to have to weigh in and kind of give some plans. Otherwise, it's just going to be a hodgepodge. Whoever has a good argument, whoever comes in first, and whoever is a favor to somebody. So I would like the county board to really discuss this. In addition, starting tomorrow, I have a survey that will be on the website, the county website. We'll put it on our social media pages. Thank you, University of Wisconsin Extension Service, Lisa Radke and Mary Pardee. We will be asking budgetary questions concerning what do they want the county to spend money on. In addition, I also have a question about what would the community want to spend our ARPA money on? And lastly, what percentage of tax increase would the citizens want to do in the long run to support county operations? So I'm anticipating that survey starting tomorrow. I'm going to close it on July 7th, I believe, and then make a report to the county board, maybe on the 20th, and if not, then in August, to help the county board see what the citizens want for that money in addition to other issues. So lots of little irons in the fire I'm trying to work on here before I move back to Stillwater.
Any other questions? Staffing updates. Oh, one of the, is it all right if we remove this from the, as long as the progress is being made on the EMS in the southern part of the county? Can we remove that as a standing agenda item now? Any objections if we do that?
Clarence, this is Matt McKenzie. I'd like to see us have it on one more agenda. That would get us to September, past the budgeting, the biggest part of the budgeting hurdle. I'd feel more comfortable with us having at least one more opportunity to address this if we need to.
All right, we'll, I think we can do that. All right, now we'll go to staffing updates.
Okay, as you may be aware, when one person leaves a unit, there is opportunity for people to kind of change positions. And that's what happened when we lost Jenny McBain. So an internal candidate, Jerry Esela, was promoted, which opened his position. So there's been a lot of movement in the children's unit. Christine Randall moved into Jerry's spot, who mostly does access. Courtney Kleber, who does currently youth justice, is moving into Christine's spot doing initial assessment. And Jen Sorrell, who's currently doing the family specialist position, is moving to the youth justice. So after all of that was said and done, Jen Sorrell's position as family specialist is open, and we currently have interviews this Friday. We also still have a CCS position available, and we will be doing at least one, maybe two interviews this Friday as well for that. We hired one CCS position, that's Kim Brown. She started part-time on June 14th and will be full-time on June 28th. We lost two of our contact tracers as things are winding down as far as contact tracing. So Alyssa Groom and Andrea Fisk they resigned on their own and have moved on to other positions outside of our agency. We hired Lori Tolliver in the economic support and income maintenance position. She started May 12th. We also took on another position for the consortium as a fully funded position, and we hired Carrie Samarzia for that, and she will be also starting on June 28th. So we have two people starting that day. We did have one other resignation. Brenna Waters Moffett resigned, and we are currently advertising that position. That is for mental health and substance use coordinator. And in the Aging and Disability Resource Center, in our 5-county consortium, we are hiring a dementia care specialist. We are, I think we have 5 candidates. We have some really good applicants. So hopefully we will be able to interview them around June 29th. Any questions about staffing?
Okay, Clark touched on this a little bit, but American Rescue Plan funds.
So I just wanted to mention to you that as we try to be very creative, and you know that we are a pretty heavy user of the general fund levy, that we are trying to research as much as we can to utilize those funds rather than levy. One of the guidance, or 2 guidance that we received, one from the Treasury and one from the Wisconsin Counties Association, do indicate that we can use that on new or enhanced behavioral health. And the latest one from the Wisconsin Counties Association does indicate that we can use that for treatment for the exacerbation of mental health and/or substance abuse, crisis intervention, and crisis hotlines, all of which we currently are paying for. So we will be trying to get some more definitive answers on what we can really use that for. And we're hoping to be able to shift some of the funding we're already obligated to pay through our mandated services to be able to use some of that funding. So I just wanted to give you a heads up. We're looking very closely into that and trying to be as creative as we can. But as Clark mentioned, it's very prescriptive. So we want to make sure we are spending it appropriately. And then once we determine that, we will put it on the wish list for higher powers than me to decide.
Yeah, and as Terry said, it is prescriptive. Those of you who are not on the county board, if you were to go to the agenda packet for yesterday's county board meeting, 6/15/21, agenda item number 13 is my write-up and my explanation of these funds. And so there's a bunch of links on there for the current uses that are outside of the lost revenue calculations. In addition, I've received requests from outside entities for different operations, and I'm basically directing them to treat it similar to a grant. Basically, make a proposal to us. What would the funds be used? How much do you want? How often do you want it? Obviously, what we're trying not to do is, given the financial straits of the county, we can't create anything that's going to create additional dollars in the long run. If we were to create a service to help with treatment, we'd have to make sure that we didn't create a program that would need funding in 2025 when that money runs out. So we're basically just looking, trying to compile things. I'll be bringing the executive committee together most likely in July and August to start looking at some of these purchases that are between $5,000 and $50,000. And then the county board would be the vetting agency for any purchases that are over $50,000 in any one allocation. So we're just at the point of making small little incidental purchases under $5,000 and then also setting policy and guidance so the county can come up with a strategic plan.
Any questions? Laura? Oh, Laura?
Not necessarily, I don't know which Laura you mean. Is it just me?
Yeah, you.
Yeah, me. As I'd said in the board meeting too, that I like to look at projects that would give us the biggest bang for the buck and help the most people that are in our county. And I see childcare and possibly having some money for incentives for either more workers or for some grants for startups to overcome some of the barriers they're having. Also, maybe some supportive grants for providers or vouchers for directly to vulnerable populations to help cover the cost of childcare. Not only could it help outlying and in the city, but this could also help businesses with possibly different group of people. We know we have a lack of childcare in our county. There's just way more kids than the spaces we have. Those jobs could be living wage jobs too. We can help with these things, and it could be something that would domino effect for businesses, for families, for kids. So I'd like that put on the project list or some research into that.
Melanie has something to say.
You go, girl.
So just a comment on your childcare startups and helping those businesses out. The actual state has actually issued, I know that like Evergrow received over $36,000 for one period, which is a 6-week period in 2020, I want to say, but I will email you those numbers that what providers and how much they received in our county, just to support those providers. They received different things, stuff to purchase, PPE, stuff they actually got grants for providing access to internet and purchase any kind of technology equipment. They also received funding to pay staff to keep them working during the pandemic. They also received extra funds to offset parents' co-pays. So, but I will send you that stuff via email.
We still have to meet about that. So I will find you too.
Any other questions? And we'll move on to 2021 year-to-date expenditures.
Okay. Laura Compton, can you put that up on there? Thank you. And I will try to be aware of those of you just on the phone who can't see this, but the financials are year-to-date through April. So theoretically, at least 1/3 of the year, 33%. Those of you who have heard me for years know some of the things I'm about to say. Grants, our levy dollars are typically used much more heavily near the end of the year. We utilize our grant funding until that runs out for various programs. So right now we're 33% through the year in theory. We've used 11% of our levy. Is that good or bad? It's normal. We've used about 40% of the grants that we budgeted for. Remember now, this budget number is literally the budget that was approved. So this budget number does not change. What changes for us in human services, we're a pretty dynamic organization in that the managers here and Terry are pretty creative with coming up with additional funding. So sometimes you'll see that at the end of a given year, our grant funding will have exceeded what we budgeted because people during the year have come up with more money, which is excellent. That's a positive thing. Medicaid, I'll just start with the expenses, I guess, is what I'll start with. So the other thing I wanted to point out is, and we've talked about this some, but I can be more explicit about it. Things that we have a lot of control over, we're of course really, really good at controlling the cost. So as an example, personnel. It's highly unusual unless we get additional funding, after the budget was passed. It's highly unusual that we're going to be wildly different from our personnel number over the course of a year. Right now, we're 33% through the year. Our personnel costs are at 32% of budget. That's not a shocker. That's not where the problem is. Training and travel. That's another thing we have quite a bit of control over. We don't have, due to the type of work that people do at our agency, we don't have 100% control over that, because if someone needs a social worker in an emergency, they need to go and they need to travel. So right now, travel, we're at, our budget was cut, as all of the county, our training and travel budget was cut from our original proposal by, I don't remember, $30,000 or $40,000. And so managers will be keeping, a really, really, really tight rein on travel to the extent they can. At this point in time, a third through the year, we're at 16% of spending on travel. Other direct, that's the biggest part of our expense budget. It represents about 40%. Other direct, of course, there's a whole bunch of stuff that falls in there. The biggies for us, as we've talked about before, are out-of-home placements. Those are the single biggest expense that ends up in that other direct. Right now, we're at 24% on that of budget. Now, that by its nature is on a 1-month lag. So we get services in a month from these places, they bill us the next month. So if we're at 24% today, we're probably tracking pretty close. That, of course, as I've talked about ad nauseum, can get really thrown off track with a couple expensive placements at a state mental health hospital or something like that. Our overhead, That's another thing where we have an awful lot of control. Those are, part of that overhead is personnel like me and the people that work with me. Part of it is electricity. Part of it is, things to take care of a building, insurance. Those things are pretty controllable. We're at 29% of our budget right now. So overall expenses through this point in the year, we're at 20%, 8% of the budget. On the revenue side, our grants were at 40%. That actually seems a little bit low to me. We use grant funding, first, but it's not unusual. MA, we're only Medicaid funding, which makes up about almost 25% of our budgeted revenue. We are at only 19%. That's mainly timing with things like Medicaid, for example, funds a lot of our crisis intervention when people get admitted to crisis beds and things like that and get follow-ups on that. That's funded by MA. Well, that's dependent on them billing us and us turning around and billing MA and then us cutting a check, back. So that's timing. Fee for service. This is an interesting one, and fee for service. I was talking with Terry Barningham about this today because she had a couple good questions. Fee for service really represents any revenue for us that is not grants, literal grants, or Medicaid. So that could range for anything from rep payee fees that we charge. It could be fees that we charge for to insurance companies or private payers for flu shots, say, things like that. A wide range of things that fall into the fee for service category. It's a relatively small part of our total revenue. But I just thought it was interesting. Right now, we're already at 50% of our budgeted fee for service revenue. And I kind of wanted to point that out to you just because we might say, great, hey, we're really generating a lot of fee for service revenue. The bummer in that case is the reason it's so high is because of out-of-home placements. We happen to have a person in one of the state mental health hospitals. Well, he has Medicare. So are we happy that Medicare exists to help us pay for that? We certainly are. And Medicare pays a pretty high percentage of the cost there at Winnebago. However, would we rather have that person not there and not have that revenue? Yes, because net, we wouldn't have the expense. And then we've had some children placements in state mental health hospitals. And we have had, and this is pretty unusual, really, a fairly large payments from private insurance companies for those kids. So again, just illustrating the point, once again, beating a dead horse. When Bill asked, how are we looking? I would say we're looking just fine. I mean, the difficult part to manage is what happens with out-of-home placements. And I think maybe, I don't know that, Jerry's not here. Laura's probably not prepared to talk about that necessarily right now, but, kind of the question is, what is kind of the lay of the land, Laura and her staff sometimes, have a feeling for whether things are spiraling for various of their clients, and they might be able to say, unless this turns around, this person's going to have to be, placed out of their home or things like that. So it's difficult to predict that. Yep, the last question.
Where do we usually run over as far as on the budget? And if we run over, where does it have to be? Where does the money get raised then? And have we ever had money that we had budgeted that we never used?
Yeah, yes is the answer to all of those. Have we run over? For sure. And we've run over significantly. I remember, I don't know, in the last year was not, actually we were under our And when I say budget, I'm talking about levy budget. And the reason I think that's the most important is it goes back to what I mentioned earlier. For example, let's say for argument's sake that we hadn't budgeted for Brighter Futures, Scott's program. And then all of a sudden, and that's really what happened, Jenny gets in touch with the state, ends up writing for this grant, and all of a sudden we have $300,000 more in revenue. But it's also reimbursement based, so we have to spend it to get it. So in a case like that, we may have budgeted, let's say $8 million. Well, now if everything went exactly according to plan, we would have spent $8,300,000. So the spending over the spending budget is much less relevant because if there's revenue to cover that, you see what I'm getting at? So when I talk about the budget, in my opinion, by far the most important piece is that levy budget. And I've been here, I think I've been here 9 years now. And I would say that there have been probably 3 of those years when we've been a couple $100,000, $200,000 or $300,000 over our levy budget. And where that typically comes is what I've been talking about. You know, it makes sense. The personnel we can control. We can control how many people we have. But it always, every year comes down to those out-of-home placements. And that last time we talked about, and I think that got distributed in the packet, where I did kind of an analysis of the court-ordered ones. If you take a look at those, they're so expensive. You know, Winnebago's $30,000 a month. The next step down from there is $15,000 to $20,000 a month in a place like Trempealeau. And that's for one person for 1 month. And so if someone is sick or needs help like that, there's just no way to control that. So, and have we been under budget? Yeah, we've been under budget also. In fact, in 2020, I think we're going to end up having been under budget by about, if I remember right, 50,000 or 30,000, something like that. So
Yeah, and there's a couple things here I think you should understand when Pete talks about those out of home placements, the high cost IMDs, your high cost foster cares. One of the things that we're investigating, which is one of the reasons I asked them to put that report together, is at some point, if we get these super high cost claims, my interpretation of state law is that we can reimburse ourselves via debt levy. The debt levy basically says you can use debt levy for court orders. My interpretation of that and Max's interpretation of that is that it's a court order, whether it's a placement, whether it's foster care placement, adversarial counsel, psychiatric evaluations, guardian ad litem. Those are all the costs that I'm looking at. And when I'm looking at we are basically so short on cash, I'm worried about paying the highway bill next month. I mean, I'm going to talk to Pete afterwards about this. I think you're going to have to eventually capture some of this money to put back in and just reimburse yourself to build the general fund back up. You got to put in $3 or $4 million to get that back. One of the areas that I'd also like to see improvements going on in the long run for all the departments. In February last year, March, I created a budget amendment, budget adjustment policy. And you might say, well, if you're getting $300,000 more in, well, you got $300,000 more in expenses, it all evens out. It makes you look bad on your audit because your audit basically says you're $300,000 over on expenses. In a simple read of it, if you don't check your revenues, it kind of looks a little bit off. If you go through, if you know you're going to have budget increases by grants or large other expenses, we'd like to see on maybe a quarterly basis or twice a year, go through the budget amendment adjustment policy. The policy is on the website under employee resources, under policies. And you can see that form that was adopted by the county board. And granted, this COVID thing kind of threw everything for a loop and I lost interest in it. But I would like to see that happen because that will make your audits and your reviews look a lot better when you know you're going to do something. So like I'm going to come to the county board in July probably and make a budget amendment to account for the $1.5 million that we got three weeks ago. Okay? You know, we're going to eventually spend that. So we should probably make a budget to say money came in, money went out. Otherwise, every dollar I spend on that is going to be unbudgeted expenses. If we spend $100,000, yeah, we got the cash, but it's not in the budget, and we're going to look like you're out of line. And so we're going to start going through that process. I just wanted to let you know.
How long before that debt levy has to be paid off, or does it have to be paid off?
What debt
Can you
levy?
guys talk into the mic?
Bill asked, how long do we have to pay off on the debt levy? So right now, what you're using, Bill, is every year we come to the county board, and on the second Tuesday of November, you authorize us taking out short-term debt levy, mostly for their highway department. We're using that to do road construction and buy equipment. What we're doing is taking on short 63-day loans, just enough to make it amortization schedule of 2 months, maybe 3 months. There's no prepayment schedule. And so what happens is we basically impose the debt levy. Come February, first part of February, we get the money in taxes because you've levied the tax on the citizens. That money comes in, you pay off the debt levy, and then you basically have the money available to do road construction. And that's what Matt is using for that. We also bought a couple squads, we bought tasers, we bought $70,000 of radio equipment. So that's what that is used for. My expectation is that you're going to have to do the same thing with some of these court order placements, because I don't see us having cash to go back into the system to build the reserves back up. And this is one way you can build your reserves back up, is by replacing your general levy money, which you're using for these high cost placements. I'll talk to Pete and get him online with this.
And also, I guess the other thing that I'd like to point out is, and this has been a discussion point before that we've talked about, but I'd just like to mention it again. And Clark is well aware of this because he's, you know, you're involved in that local group of cooperating administrators. We are the state and probably the nation, as far as I know. But there aren't many counties in the state of Wisconsin that aren't struggling with out-of-home placements. And so everybody, administrators all around are trying to grapple with this, and county boards, you know, what do you do? How do you do this? So
your county estimates they have an unbudgeted $2 million increase in their out-of-home placements for this calendar year. Now, they have these super high cost individuals, and they didn't budget for that. No, they have $2 million in the bank. They can cover that. You don't, you know, so that's, you're basically, you're driving a car that needs an engine replacement soon, but you don't have enough money for the engine. So be careful.
Well, and it's also a matter of time with any county. You've only got so many $2 million sitting around unbudgeted like that, you know. So anyway, does anybody have questions about any of this stuff? I'm available at any time. I've said this many times also. If anytime any of you guys want to get a hold of me and ask me detailed questions, or you want me to show you certain things, I'll be happy to do it. So that's no trouble.
Laura, your hand is still up, but I think that must be from, well, no, it's not. No, it was before. Any other questions? And we'll move on to the written materials. Anyone have any questions about those? If you look those over, any of the supervisors have any comments to make on those? Otherwise, we'll move on to board member updates and agenda items. Anybody on the board would like to make any comments about things we can have on future agendas?
It's Matt Horning. I guess I would just, if there's anything in these written materials that needs a lot of attention, these documents are pretty dense and often they've got links to other documents, and I certainly don't read all of that. And so I guess if there's something that needs more than a sort of skim, Terry or somebody else, if you would draw our attention to it, I guess I'd appreciate that.
Bill?
Did we lose a bunch of board members? Seemed like we have several people that are no longer with us
No,
as far as the main board. Didn't we have like 9 people or 11?
We have 9.
We have 9 now?
there's a couple who aren't at the meeting.
Right.
We had 11, and it came to our attention that that was not in line with the Board of Health requirements, which cannot be more than 9. So through attrition, we've gotten down to 9.
Yeah, and Laura Cruz and Pepe aren't in attendance at this meeting. Any other questions? Board member updates, comments? Laura, is your hand up or? It is on our screen.
No, I always do this. I have one of these, so I use one of these. I have not clicked anything, so I do the old manual hand.
We just cured that by moving our mouse.
There you go. Move that mouse.
Okay. Any other business?
We just have a question on the next meeting date, September 15th. Can that be changed somehow? I don't believe you could make that date, nor can I. Because the Knights of Columbus are going to have a mass or a celebration for the COVID workers.
Those are, our regular meeting dates are scheduled in advance at the beginning of the year.
I know, but can that date be changed now?
We don't normally do that. I mean, I don't know that I don't remember ever changing that as long as I've been on this board.
We usually do it the third.
We can't hear anything that's going on right now, Clarence.
Thank you.
We're talking about possibly, would anyone have a problem if we change the next meeting date in September from the 15th to the 22nd?
For what reason?
I've kind of planned everything around it, so.
Yeah, that's what I was concerned about, because we usually set those dates well in advance.
It wouldn't matter to me.
Yeah, I guess I just thought it would be easy. I would rather see it changed, but if there's a problem with it, I don't have a problem.
Any other questions, comments, or other business? Otherwise, if not, we've gone through our agenda and
Well, then I move we adjourn.
Do we need to go out of the hearing since we just recessed it, or are we out of it?
We were on it.
Yeah, we did recess it. So I guess we first need a motion to go out of public hearing, I guess.
I'll move that we leave the public hearing.
I'll second.
And I think is that a roll call too? Yep.
Clarence Campbell.
Yes.
Dr. Horning,
Yes.
Pepe Kabasa, Dr. Keller,
Here.
Laura Cruz, Matt McKenzie,
Yes.
Bill Metzinger,
Yes.
Laura Negro,
Yes.
Charlie Ortman.
Yes.
Okay, we're out of public hearing, and now, Dr. Keller, you can make your motion.
All right, thank you. Move we adjourn.
Second.
I heard a second, so motion made and seconded that we adjourn. All in favor?
Aye.
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 Opposed? Motion carries.
See you in September.
Take care, everybody.
Thanks, everyone.
Good meeting, guys.
Let's go over and see Sherry.
Yeah.